Hello everyone! Magandang gabi. Hi Willem. Hi Iris. Welcome to Cup Conversations. I will be your host for tonight. My name is Ayen de la Torre and I'm from Where to Next. So ito yung pinakaunang pilot episode of Cup Online. But for some of you guys, alam naman natin that Cup and Coffee Bean and Tea Leaf, they've been hosting a lot of gatherings and events in their stores. But since pandemic ngayon and we need to stay at home, we actually transferred it online. And I think it's a good reminder that even though we're far apart and we have to stay at home and practice social distancing, marami pa ring paraan para magkaroon ng mga meaningful na kwentuhan. So let's get started. So our session today is actually quite special. It's about coping behind the frontlines, a webinar on mental health. And mamaya, hindi lang ako magsasalita, meron tayong tatlong guests, which are medical experts and frontliners. So explain nila ano nga ba yung mga struggles, ano nga ba yung mga pinagdadaanan ng mga medical frontliners and essential workers natin ngayon. And these are some stories that maybe we haven't seen online or haven't even seen on TV. And if you're also a frontliner tuning in, I want to say first and foremost, maraming salamat sa serbisyo. We are alive and healthy because of your sacrifices. And our experts will also share tips on how to deal with the emotional and mental stress of working on the front lines. Good evening, Gian, Diane. So if you notice, the title is Cup Conversations. So every time meron kayong comments or insights, please share it with us as well. But before we get into our talk, September is actually Happy Coffee Bean Month, and it's a month dedicated to our frontliners. So buong month, we've been pouring messages and support for our frontliners, and you can also join the movement by sharing your personal messages on the comment section below. Kung may kakilala kayo na frontliner, pwede nyo silang itag, pwede nyo sabihin maraming salamat for your service, or even in general, if you just want to send your gratitude to our Filipino frontliners. And as an incentive, we will be also giving you GCs or electronic certificates from Coffee Bean and Tea Leaf, and we will select some of the heartwarming messages by the end of the show. So go lang and go. And for me personally, I just want to thank my cousin, Dr. Nadine Romano. I am so proud of you, and I'm happy and very thankful that you're still safe and healthy. Okay, so now we'll start and interview our first guest. So our first guest is actually an emergency medicine resident at Hospital ng Makati. So frontliner talaga siya. When he's off duty, he also loves watching movies and streaming shows on Netflix. So for everyone that's tuning in, let's all welcome Dr. Joseph Magtibay.
Hi, and good evening.
Hi, Ian. Sorry, nalita ko ng onte. How are you?
I'm okay. I'm actually at home, so feeling.
And you mentioned na nasa bahay ka ngayon, but you haven't been at home for the past 6 or 7 months. So anong pakiramdam na ngayon nasa bahay ka na at kasama mo yung mga mahal mo sa buhay?
Ayun, nalaman ko na biniba ng kapatid ko yung grupo, so isa na lang yung room namin. But it's actually, it's masaya kasi finally, after a long time. And yet, even then nga kasi, meron na rin anxieties dependent on the fever, so which I still have to protect myself as well as them. So, ayun. Pero at least I'm here, so finally.
And cherish diba, the
Yeah.
moments that we can have with our family.
Yeah.
So, what is it like to work in the ER? Meron bang mga unique na challenges or pagsubok na mas naramdaman mo lang ngayon that we're currently in a pandemic?
Actually, alam mo, madalas tanongin ko ng friends ko. And a lot of people na, mga mamusta, ganyan. Ito yung common question. How is it in the ER, ganyan. And if you've actually ever been to an ER, like, yung ginagawa namin kasi pre-pandemic, it's still the same.
Hmm.
That's that. Yun yung dapat naiintindihan ng mga tao. It's the same workload, it's the same working hours. Only now, and because of the pandemic, we got really overwhelmed kasi parang nag-double yung trabaho. But what's different is that yung favorite ko ikwento sa friends ko, sometimes I feel like I'm in space. I'm sure marami naman nakakita ng mga PPE, di ba? Marami pa.
Yeah.
Diba?
Yung face shield, the mask.
Yeah. And mukha kaming astronaut. And actually, it feels like you're an astronaut. Kasi, well, di ba sa ER and as an emergency medicine resident, kaya kami ER because, we do things fast. We love the adrenaline, yung mga mabilisang galaw, ganyan. Pero with the PPE, parang lahat mabagal. Parang, gravity, pero like, all of our movements are like significantly slower, ganyan. Of course, we still, alam mo yun, nagko-cope din kami, ganun. So yun, isa pang hardship yun, actually. Lahat mabagal. Pero, minsan nakakatawa kasi yung mga usual movements na we know na dapat nagagawa namin yung bilis, it's like a lot slower. So, yun. Para siya parang
Yeah, ang alam ko lang kasi madalas yung nasa Grey's Anatomy, which is parang may time ka pa for love life, ang dami mo pang drama, pero I think in the real Frontlines, as in really focus in the work and making sure that you save lives.
Kung nanonood sila ng Grey's Anatomy, yung mga food block, gano'n, yun, it's like that, pero like imagine everyone in TPN moving a lot slower. So medyo kumaling pala yung gano'n drama series, pero yun, gano'n yung ER na yun.
And you mentioned na dati pa naman talaga sobrang overwhelming yung workload na isang medical frontliner. Pero ngayon, syempre, mas marami pang challenges with the PPE and also the risk of getting sick yourself. How do you cope with that? How do you make sure that you still take care of your mental health?
Maraming parang new things that the pandemic brought us na we didn't really have before. So, of course, dati mga workload na patients, diba? And I'm sure everyone here naman knows that. Pero because of the pandemic and then nag-lockdown pa, actually the first thing na sobrang nalungkot ako when the lockdown started is that yung mga usual things that I do we call it detox when we field. So when we're stressed, we detox. I think may mga ibang ganun na naman yung we detox. So para ma-unstress kami, ma-unload yung stress namin. Usual things that we use to detox, nawala. So parang nadagdagan na yung stress mo, tapos mapag-detox. Like for me, for example, I go to the gym, I go to random movies, like sobrang stress ko na, I just go to the cinema, and then watch whatever, ganyan, random movie. Those things na hindi na namin magawa. So, coping mentally. I think ako nag-adjust. Ikaw ba? Ako kasi parang kunwari, like for in terms of workout, online workouts, di ba?
Parang kailangan mong i-adjust yung context niya to the current reality. And actually, I wanted to say good evening to everyone that's just tuning in. And kayo rin, pwede kayong kasama dito sa kwentuhan. So, if you practice any form of detox, according to Ryan, or coping mechanisms to deal with stress, just say yes or no. And if you want to share kung ano man yun, you can also add it in the comment section. So as for me, I also do yoga using Down Dog, as in binili ko yung app na may bayad. Dati naman ayoko talaga na may mga bayad na app. But I felt like having something that centers me and also moves my body helps me manage my anxiety and deal with the stresses.
Yes, ako naman kasi yung workout ko na rin yung pandemic ay calisthenics. So meron kaming calisthenics gym class before. It's Sparta Calisthenics Academy because you're interested. Tapos yun, gumawa rin sila ng online workouts for that. So yun, that worked. And then like for cryo, watching movies, as we were talking kanina before the show, diba? Ang adjustment, Netflix. Netflix. Tapos kung ikaw bumili ka ng yoga app, ako bumili ako ng HBO Go, gano'n. Bumili din ako ng Amazon Prime, gano'n.
Oh my God.
Kaya naman dumami kasi kasi yun yung those are the things that I usually do to unload and to de-stress. So yun kasi yung nawala sa lockdown. And syempre we want to be role models na not follow our practices. So ayun. So ako in-adjust ko yung like detox mechanisms ko to like the new one.
And even if you're a social person, may ways pa rin naman na gawin siya with other people. So I find na kunyari gusto mo mag-Zumba on Zoom, kaya pa rin siya kahit na hindi tayo magkakasama at hindi yung mga powers natin nag-interact with each other. But there's still ways to come together and do the things that we love with each other as well.
Yeah, actually na-appreciate ko yung mga ganitong calls. Pre-pandemic, I really don't have video calls, mga ganitong conferences. Kasi nakaka-depersonalize siya for me. Like, mag-meet na lang tayo, diba? Pero like, the lockdown really made me understand, like, a deeper, how to parang appreciate na yung friendships mo has all this deeper meaning. You don't really need to be like, in front of each other. Then ko na-appreciate na, oh my God, nag-video call lang tayo, tapos nawala yung pagka-miss ko sa mga tao. Ay, so also, like, with friends, like, we love playing board games kasi with my friends. So we discovered this like websites na parang you guys can all play. Habang naka-Zoom kami, naglalaro rin kami ng... So yan, so buti na lang may technology.
And speaking of video games, si Apple Espejo also said that he copes through video games and meron din siyang digital blog or diary. So journaling, that's good. And among the websites for games, nang na-try ko yung Codenames, if you know that board game, meron siyang website version at meron pa siyang Filipino version kung gusto mo yung names or codes are all Filipino or cultural codes that we all know.
Yes, ito-try ko. Ito-try ko. Actually, kasi yung mahirap with us, for example, is that I guess, and this is different for the other lay people, I guess, lalo na nung nag-ease up yung quarantine. For frontliners kasi, syempre, most of your friends din are, well, frontliners. So, lahat kami, same exposure, may exposure din kami. So, parang, sometimes sometimes, kahit na parang gusto lang namin lumabas together, actually, ayaw namin lumabas together. Exposures na,
mahirap na.
Lahat kami frontline. So yeah, so actually, if like for everyone who's watching yan, I think yung technology, yung mga ganitong klase ng websites that allows us to like bond together online really helped me at least.
And si Gia naman daw, biking. So I guess outdoor recreation, pwede rin, no? At least mas safe siya than being in an area na wala masyadong ventilation. What is your advice naman to people who are having difficulties dealing with their mental health? Like it's really more of a crisis na, medyo may something na mali in this pandemic. What are other steps that they can take apart from doing things that they love or that relaxes them?
Ayen kasi for healthcare workers, for example, and I'm sure I speak for all of the healthcare workers, ang una naman talaga natin inaaral, and this goes for all the people watching. Health is not the absence of disease. Kasi minsan parang inisip ng mga tao, dahil wala akong sakit, I'm healthy. Actually, if you look it up, the World Health Organization definition for health is the totality of the physical, emotional, mental, social well-being of a human being. So kung wala kang sakit, pero yung mental problems mo or like yung stressors mo, it's everywhere, social problems ang dami, you're not considered healthy. So I think I speak for most healthcare workers. They know when their mental health is challenged or in danger. Medyo mahirap lang talaga sa amin kasi syempre, ang mahirap sa mental health workers, mental health workers, we can't just randomly take a mental health break. Because that would mean more duties for the other people, leaving out your team. So kapag nawala ka, walang mag-duty, mga ganun kasi yung yung mahirap sa amin. So, importante, I think, is to adjust the things that you do to detoxify. Magaling kami dyan, may mga fastings kami na ginagawa to de-stress ourselves.
Fasting?
To adjust to the new normal. Kasi nga, yun, hindi ka masyadong makaka-mental. But, I think, I speak for all healthcare workers, they know naman na may problema na sila. Alam nila yan. They have to seek help soon.
And even if you're not in the front lines, if you really feel like yung thoughts mo medyo pahaba na, medyo negative na, and it's prolonged, or if you feel like hindi ka na makagising na maayos, then really, there is no shame in seeking help. And then there's also Jenny who said the certified plantita in baking. Agree. As you notice, parehas kami ni Ryan na meron ding plants in our background that obviously helps with our mental health.
Nagbe-bake ka ba?
Nagbe-bake ako. Nagbe-bake ako.
God.
Pero first time lang. Never ako nagluluto dati. As in, alam to ng mga friends ko. Never akong... So, pa nagka-camping kami, ako lang yung taga-picture, pero never taga-luto. Pero ngayon, marunong na ako mag-bake ng cake.
Nag-try ako magluto, pero parang mas na-stress ako. So, natutunan ko na tagilin na lang yun kasi nakakatagdag ko siya sa mental health problem ko pag nagluto ako.
So, choose na lang what you are confident in.
Yes.
All right. So, thank you so much, Dr. Ryan. So, Ryan will be back later on when we do our panel discussions. But for now, we'll say goodbye to him so we can proceed with our next guest. Maraming salamat. All right. So, our next guest is actually a psychometrician and a lecturer at the Department of Psychology at Miriam College. So actually, psychology graduate din ako, pero hindi ako umabot dun sa psychometrician part. But apart from being a psychometrician, she also enjoys playing the ukulele. And she does cover videos to make sure that it becomes her way of expressing herself as well. Okay, so let us all welcome Miss Faith Moral. Hi, Faith. Oops, na-drop pa si Faith. This is again the realities of working from home. Minsan yung LTE natin, lalo pag may bagyo, nawawala. But let's answer some of the questions first. So Yona is actually my friend. She also taught me how to bake, which is really helping me cope with my mental stress. Maraming mga tagaluto, maraming mga plantita. At according to Lily, tinag na si Kenneth na itry mo rin mag-baking. Kahit yung sobrang simple lang, pinaka-simple siguro, cookies or brownies, those are things that you can easily do. Watch na lang sa YouTube and ilang ingredients lang yung kailangan. And I think while waiting for Faith, I also want to share why this episode is important to me. Because isa akong freelance creative, meaning yung mga project racket, hindi siya certain. Laging may hinihintay na proyekto, and syempre because of the pandemic, ang daming delays and ang daming hindi mo sigurado kung matutuloy. So that obviously did not help me with my anxiety and mental health. Because every time may project, gusto ko mag-yes kaagad. Dahil pakiramdam ko, hindi na dadating to uli. And so, madalas ang nangyayari is I've experienced burnout multiple times during the past 6 months because I've been taking on so many work and projects simply because I was afraid that there won't be any other projects coming in. But I actually had a free call with the therapist the other day kasi nga parang naramdaman ko na there's something wrong. I've been very anxious and she told me na I really needed to take a rest. As in yun lang, simple lang, pahinga. And pakiramdaman mo talaga na you need to take care of yourself because you can't be there for other people, you can't serve other people, and you can't pour from an empty cup if ikaw mismo ubos ka. So that's what I'm trying to learn, and I'm trying for you, hopefully you also learn that we need to balance taking care of ourselves while also taking care of others. So while waiting for Faith, let's actually do first a quick game. Okay, so simple game is an anagram. Kung alam niyo yung anagram, isa siyang word or phrase that is formed by rearranging another set of words. So our word for tonight is the title of the show. So, Carrying Cup Conversations. So, isip lang kayo ng isang word, just one simple word that you can get from this set of words. So, kunyari example is ring. And then when you type it in the comment section, you'll have the chance to win electronic GCs from Coffee Bean and Tea Leaf. Sobrang simple lang. Enter as many as you can, and then later on, our team will choose some of the winners. So, maliban sa ring, ano pa ba yung pwedeng words that you can form from carrying cup conversations? Ring. Oo, si Rich. Rich is my partner in Where to Next. But yun na yung example, Rich. So, you need to think of another word. Passionate from John. Nation from Kathy. Love it. Very, Filipino. Convert. Sige, tuloy-tuloy lang kayo and then we will announce the winner in a few minutes. Any word that comes out of Carrying Cup Conversations, this will also help practice your mental agility or parang brain exercise games din to keep us focused and keep us energetic rin for our brain to continue working even though it's at night na. Rapport, actor, versions. Daming nation, which is good. Marami rin akong iba pang mga games. Alam ko, Among Us is also a good digital game that you can do with your friends. And even doing karaoke on Zoom, pwede nyo siyang gawin. Magpo-play lang kayo ng YouTube video. And then with the lyrics, tas kanya-kanya kayo ng kanta. So kung sino man yung naka-mute, siya yung makikinig. And then kung sino man yung off-mute, siya yung kakanta ng song. So there's so many ways for us to still come together and do things we love with the people we love, even though we're currently in a pandemic. Okay, let's see if we have a winner. Okay, 1 more minute. So tuloy-tuloy lang. Enter as many as you can, and later on, we'll announce who will win the EGCs from Coffee Bean and Tea Leaf. And whoever wins, just send a direct message to the Facebook page para ma-figure out how to give you those GCs. So thanks also to Coffee Bean for my chai latte tonight, a sponsor. It's nice to just have this warm cup of coffee with friends that are in our chat to still feel like we're not alone during these uncertain times. Okay, so we actually have a winner. So congratulations to, drumroll please, ako lang mag-isa, Kathy Gayo. So yung word mo is versus. Congratulations, Kathy Gayo. You won GCs from Coffee Bean and Tea Leaf, and just message the page to claim your prize. For everyone else, maraming salamat for your entries, and don't worry, marami pa kaming pa-games mamaya, and you can keep on sending your messages for our frontliners since we'll be choosing some heartwarming ones that will also win GCs by the end of this session. So kung gusto niyo silang itag, kung may particular people that you want to thank, then you can do so as well in the comment section. Okay, so now, let me reintroduce our second guest. So again, she's a psychometrician and lecturer at the Department of Psychology at Miriam. Mahilig din siya mag-ukulele and mag-cover videos as a form of release, self-care, and self-expression. Let's all welcome Faith Moral. Hi, Faith.
Hi, Ayen.
Welcome back.
Hello, how are you? Thank you.
Okay naman. My first
Yes.
question lang is, ano yung favorite cover video na nagawa mo recently with your ukulele?
Oh, my favorite cover video that I did was the one with Amy Winehouse. Yeah, because she's my favorite. Yeah.
Which song? Anong
I
song ni
actually
Amy
forgot.
Marnez?
I forgot which one I did a cover of it. But I like most of her songs naman because I like jazz.
Hmm. And you can actually
Mhm.
catch, so Faith has a YouTube channel. So mamaya i-link na lang
Yes,
natin para
I'll tell you
mapakinggan nila.
later. Mhm.
But
Mhm.
speaking of your day job or your profession as a psychometrician, what are some issues that medical and also non-medical frontliners face in this crazy, trying times that we live in?
Mhm. Siguro I just want to begin by saying that it's not just the healthcare workers that we consider
Mm-hmm.
frontliners right now. We have non-medical frontliners also. So there are essential workers. Basically, they keep the community running. So these are our food service delivery workers, people who work in the grocery stores, the sanitation workers, law enforcers, even our educators. They never stopped working at any point during the whole pandemic situation. So it makes sense. It makes sense that they are really tired and exhausted. Yun. So right now, what I'm going to focus on would be the psychological issues that they face. So coming from
Mm-hmm.
these things that I'm gonna tell you tonight are coming from stories of clients, from friends from the medical community, because of course sometimes we talk to each other if they have the time, and then
Mm-mm.
also the colleagues in the helping professions, because basically we also are in the front lines when we deal with our clients. So yeah, there are actually three things that I'm gonna point out tonight. So first would be stress. So
Mm.
it's not just physical stress. It's not something that you just experience physiologically, but this is stress psychologically. No? So it's a mental stress from having to attend to patients, having to attend to clients, while in the midst of a situation that is anxiety provoking. So, bakit siya anxiety provoking? Because right now, di ba, in this
Mm-hmm.
pandemic situation, sabi nga nila, what we're experiencing is something that's very volatile, very uncertain. It's a complex situation, and ambiguous. So, anong tawag doon is VUCA framework. And what does this mean? So, di ba, week in and week out, we experience so many new things, di ba?
Mm-hmm.
We have to adjust to so many changes in terms of the
Oops, I think nawala si Faith. While we're waiting for her, I wanted to ask everyone that's listening, since we're talking about dealing with stress, have you been practicing self-care during this pandemic? Self-care, detox, coping mechanism, iba-iba man sila ng word, it's kind of the same thing. And most of the time nga may misconception that self-care is selfish. But I think we've all learned that it's not, because it's really our way of moving forward and coping with all the changes and uncertainties that we're facing now. Ako mismo yung self-care ko, which I mentioned kanina, was baking. But I also bake midnight. Kasi feel ko parang pag yung mind ko, tuloy-tuloy pa rin, takbo pa rin ang takbo kahit wala ng trabaho. I can't just rest. So what I do is I use my hands, I measure things. It's nice to create something with my hands dahil madalas nga as a creative freelancer, madalas lagi lang ako nasa laptop, lagi lang electronic and screen and Wi-Fi, which obviously drains a lot of your energy. And doing something with your hands, whether that's exercising or in my case, baking, and also sharing it with your loved ones, parang sobrang mas fulfilling siya for me. Si Sam nagbababad sa Netflix. Yeah, I mean, do whatever feels right to you, di ba? Hindi naman ibig sabihin na may wrong self-care or right self-care. As long as it's not abusing substances or anything illegal, everything is, available to us, especially kung kaya naman. Sometimes it's also just playing music. Si Rach, she deletes her social media apps. Sometimes, for me din, kahit yung phone ko, hindi ko na siya sinasama sa bedroom ko. na tinatry ko na lang gumising naturally, which is kind of hard kasi hindi ako morning person, but I realized na mas relax yung mind ko when I'm actually not with my phone or not have it scrolling from Instagram, tas mamaya 5 oras na pala yung natapos dun sa oras ko. So there, okay. So for now, we'll go first to our third guest, which is Dr. Rodney. Let me share his profile. So si Dr. Rodney is actually a doctor to the barrio, a former doctor to the barrio and municipal health officer for Bawak, Marinduque. He has been working in our government for a whole decade. And he now teaches at the Lyceum of Northwestern University College of Medicine at sa Development Academy of the Philippines. Ang dami. But currently, maliban sa pagiging lecturer, he is also the head of the community-based mental health capacity building and training unit of our National Center for Mental Health. So for everyone tuning in, allow me to welcome Dr. Rodney Boncajes.
Hey,
Hi, Doc.
Ayen.
Yeah.
Hi. Isang malusog na gabi sa ating lahat.
At isang masayang gabi sana. And I remember you mentioned that maliban sa pagiging doctor, you're also a plantito because of this quarantine. So
Yes.
to start our kwentuhan, what is your favorite plant, baby, ngayon?
Well, hindi talaga ako marunong mag-alaga ng plants nung una. As in, namamatayan ako ng plants, even the cactus. So, kahit na biology major ako, hindi ko pala alam kung paano mag-alaga ng plants. So, nitong quarantine na, nakita ko yung kahalagahan ng pagkakaroon ng iba pang hobby just to release the stress and then makita natin kung saan pa natin pwedeng gamitin yung ating mga time na sobra habang naka-quarantine or after from work. So, from then on, yung mga coworkers ko would give me plants na buhay na. So, tapos saka ko sila aalagaan. So, ano naman, nabubuhay naman sila ngayon. Striving naman sila. Kaya yun yung kwento ng pagiging plantito ko ngayon.
So kung hindi mo kaya maging plantito from seed to actual plant, try mo na lang na kumuha ng gift sa'yo na inalagaan na ng iba and kailangan mo lang i-maintain.
Yes, oo.
May pa-shoutout si Roy, Doc Rodney, fellow plantito.
Yeah.
Actually, for the plantitos and plantitas, snake plants are one of the easiest to take care if you're just getting into the journey. And I know Sir Rodney has a presentation, but before that, I wanted to ask our audience, ito medyo heavy, so just say yes or no. You don't have to share any of your personal details if you don't feel comfortable. But I wanted to ask, since we're talking about mental health, have you opened up to anyone lately about any problems that you're dealing with? Kahit hindi man medical professional, kahit kaibigan, kahit magulang, or one of your loved ones, na-try mo na bang mag-reach out na magsabi, like, bro, sis, I'm not okay. Can you talk to me? And kayo, Sir Rodney, before you start your presentation, was there a time during this
Ako pala
pandemic?
ang unang sasagot, no? Yeah, oo. So, kailangan natin yon actually kasi dito ngayon kasi 'di ba napaka-uncertain. Yung sabi kanina ni Faith, volatile, uncertain, ambiguous, complex yung situations. So, nakakatulong yung meron kang pinagsasabihan ng problem mo. So, on my part, I do have mentors whom I discuss with my concerns. So, they guide me professionally and as well as yung mga snippets sa buhay. So maganda yon kasi sabi natin nakakatulong sa mental health yung you are talking to someone who can validate your feelings, you are talking to someone who can understand you because yung pinagdadaanan nyo could be similar and meron kang makukuhang mga learnings sa kanya na pwede mo magamit sa iyo para makakope ka din doon sa present na situation. Okay? Yan. Okay. So, good evening, everyone. So, for my presentation, I would like to discuss first what are the issues that the medical and non-medical frontliners face in these trying times. So, yung mga issues na common sa atin ngayon bilang mga medical frontliners and non-medical frontliners is number one, balancing our responsibilities. Balancing our responsibilities in terms of caring for our patients, and of course, balancing our responsibilities as individuals, as family members, as head of the family, bilang anak, bilang magulang, bilang asawa, bilang family member. So yung pagbabalance ng pagiging isang worker at pagiging family member ay mahirap sa sitwasyon natin ngayon. So pangalawa, ang isa pang issue natin ngayon ay yung increasing number of patients and co-workers, especially yung mga kasamahan natin na medical frontliners din, na nagiging positive na rin sa COVID. So nakikita natin, di ba, dati tayo yung nag-aalaga or tayo yung nangangalaga sa kalusugan ng lahat. Pero because of our constant exposure to this virus, tayo mismo yung nagkakaroon din ng infection. So number 3 is the high level of fear or contagion and infecting family members, which can lead now to emotional disturbance, uncertainty, and stigmatization. So dahil dun sa takot na nararamdaman natin na baka makahawa tayo or baka makahawa tayo or baka ma-infect natin yung family members natin, nagkakaroon tayo ng emotional problems, nagkakaroon tayo ng mga negative thoughts about uncertainties, nagkakaroon tayo ng stigma pagdating dun sa mga individuals who have COVID or communities with high cases of COVID. So isa pa nating problem or isa pa nating concern ay yung massive flow or workflow adjustment. So that's number 4. So massive workflow adjustment in the clinical setting and in the community setting. So nakita natin ngayon ang bilis magbago ng ating mga protocols. So kung ano yung nilabas na guidelines sa DOH o kaya sa WHO, kailangan i-adapt natin para makahabol tayo dun sa mga recent na mga advances in preventing the infection. So ang nangyayari, kailangan nating magbago din ng ating mga workflow adjustments. So nakikita natin mas mahaba yung working hours ng mga medical frontliner, katulad na rin ng mga non-medical frontliner, mas marami yung workload, and of course, pag mas marami yung workload, mas mahaba yung time, mas overwhelming yung responsibilities. Okay, another problem or another issue is the shortage of resources. So shortage of resources could be anything. It could be the PPEs that protect our frontliners. It could be the shortage of transportation during the enhanced community quarantine. It could be the shortage of bed, the absence or the lack of medication, and even the shortage of human resources. Kasi habang tumatagal itong pandemic, hindi naman dumadami ang ating mga healthcare workers. So the more na na-expose sila at nagkakaroon sila ng infection, kumukonti din yung nakakatugod dun sa pangangailangan natin. Another problem or another concern is yung protecting the mental health of all individuals, especially the healthcare workers. So our healthcare workers being exposed to stressful environment on a daily basis may have experienced burnout, may feel anxiety or may have feelings of anxiety, may feel depressed at some times, or they could be very vulnerable to stress-related reactions, or could be simple insomnia or fatigue. And then pag minsan these feelings or negative thoughts can lead to frustrations over many things. So another concern among the healthcare workers is the problems in approaching the pandemic systematically. So ito yung sinasabi natin na pag minsan yung role natin sa bilang healthcare workers ay pwede tayong part ng team or pwedeng tayo yung overall na nagli-lead ng team. So tama yung sinabi ni Faith kanina na pag sinabi natin na medical frontliner and non-medical frontliner, we should not limit yung ating thought doon sa mga nasa hospital, because at the community level, our municipal health doctors, our public health nurses, our rural health midwives are also doing the same in preventing the infection and taking care of the health of our community people. So hindi lang yung mga nasa ospital yung frontliners natin. So dun sa approaching the problem systematically, nararamdaman to ng ating mga frontliners sa community. Kasi pag minsan hindi nandito na sila o nahihirapan na sila kasi pwede silang member ng team pero sila din talaga yung nagli-lead ng overall effort ng municipality. So another concern is the communication update. Sabi nga natin kanina, with the ever-revolving and rapidly changing guidelines, pag minsan kung hindi natin na-update o hindi natin na i-cascade yung information o yung appropriate information, pag minsan outdated na yung alam natin. So nangyayari, nahuhuli tayo sa mga current trends or current guidelines, so mas nagiging alanganin yung sitwasyon natin. Okay, so another problem or another concern is the policy changes in the clinical and community setting. So sabi nga natin, hindi tayo magkakapareho ng guidelines pagdating sa mga munisipyo. So na-experience natin 'yan. So pag pupunta ka dito sa isang lugar nito, kailangan mo ng swab test. Pag pupunta ka doon sa kabilang lugar na to, hindi ka pwedeng pumasok unless ikaw ay merong rapid testing. So, dahil pabago-bago yung policy, yung ating ding mga frontliners na tumatawid from one place to another is nahihirapan din, di ba? And then last but not the least is of course promoting the general well-being. Because of the situation, hindi na tayo nakakakain ng maayos. Yung mga frontliners natin, gusto nating tanungin, nakakatulog pa kaya sila or nakakapag-relax pa kaya sila? Nakagagawa pa ba nila yung kanilang mga physical activities na pwedeng dati nilang na-enjoy o dating ito yung pang-distress nila. And then, of course, yung social connection. Because of the limitations doon sa ating pakikisalamuha, because of the physical distancing, syempre, nasasanay na tayo ngayon na we communicate through social media. But for our healthcare workers, malaki kasing impact na meron kang support system na may mauuwian kang bahay, you can communicate and you can have contact with your support system, with your family members. Nakakawala kasi ng pagod yon. Okay? So, those are the issues that our frontliners are facing in this trying time. So, another issue that I would like to pose is yung what can be the advice or meron pa pala, being quarantined. Sige. Yung being quarantined, nagiging issue din yun kasi sabi nga natin, yung mga healthcare workers, sanay sila na humaharap doon sa trabaho. They are doing their best para maalagaan yung ating mga community. Pero in times na sila naman ang nagkakaroon ng positive na test for COVID or sila yung kailangan quarantine because of exposure, nagiging problem din to. Kasi syempre, nagkakaroon sila ng overwhelming na emotions kasi sila na yung nagpa-positive or sila na yung kailangang alagaan this time. So, syempre, iniisip din nila yung kanilang trabaho, iniisip din nila yung kanilang family members. Pero when I talk to some of the healthcare workers at the community level, pag minsan daw, yung pagiging yung ma-quarantine sila, yun lang yung nagiging respite nila or yun yung nagiging rest nila. So pag minsan hindi nila alam kung kailangan ba nila magiging thankful kasi dahil na-quarantine sila, kailangan nilang nakakapagpahinga sila ng mas maayos. So nagiging ambivalent tuloy pag minsan yung pakiramdam nila doon sa pagiging quarantine. Okay. So another issue that I would like to discuss is, what are my advice to frontliners who are having difficulties in dealing with mental health problems in this pandemic. So bilang isang mental health professional, what I would like to remind everyone is first, recognize the symptoms of stress you may be experiencing. Of course, sabi natin, if you know kung ano yung nangyayari sa katawan mo, alam mo or makakaroon ka ng idea kung paano ka magkukup. So awareness of a situation would lead us to understanding the situation and then would lead us to compassion or would lead us to a better coping mechanism. So another advice is that know about the stress-related disorders such as compassion fatigue and burnout. Kasi sabi natin, kung alam mo na merong mga ganitong conditions, you will be able or you would make effort para mas maintindihan tong mga to and then ma-observe mo yung sarili mo kung nararamdaman mo na ba siya and then kung kailangan mo nang humingi ng tulong, mas magiging aware ka na ito ay beyond na doon sa capacity mo. Third advice is communicate with your coworkers, supervisors, and employees about job stress. So sabi nga natin, since we are all in this ocean of pandemic, but we have different boats na sinasakyan, so magkakaiba tayo ng approach, nakaka-release tayo ng ating mga hinaing or nakakapagsabi tayo ng ating mga concerns dun sa mga tao na nakakaintindi din sa atin, of course, di ba? So, kung halimbawa nahihirapan tayo o meron tayong mga gustong sabihin na makakatulong dapat doon sa ating present situation, the key is communication with our coworkers and other members of the team. Okay. Another advice is remind yourself that everyone are performing a crucial role in this unusual situation with limited resources. Kasi pag minsan na-overwhelm tayo, so hindi natin na-realize na we can only do a little thing for this situation because of the limited capacity and because of the volatility, uncertainty, complexity, and ambiguity of the situation. So, pag nire-remind natin yung sarili natin na ito lang yung kaya natin gawin para sa ganito kalimitadong resources, mas nagiging kind tayo sa sarili natin. Mas magiging forgiving tayo dun sa nagiging shortcomings natin kasi mas na-identify natin na hanggang dito lang talaga yung pwede nating magawa for now. Okay? So another advice is increase your sense of control by identify and accept those things which you do not have control over and the things that you can control over. So parang katulad din nung kanina, with the limited resources, tingnan mo within your reach or within your resources, alin ba yung kaya mo lang maibigay? Alin ba yung within your control? Alin ba yung within outside your control or outside your control? So for example, in the situation na COVID pandemic, alam natin na we cannot control the pandemic yet. Diba? Wala pang gamot, wala pang bakuna, dumadami yung cases. So it is a thing that we cannot control or a circumstance that is beyond our control. Pero yung what is within our control is how we will react or how can we react appropriately to this pandemic. So for example, what we can control is our hygiene, our minimum observation of the minimum health standard, wearing our face mask at all times, not leaving house if not necessary, protecting our immune system by getting enough sleep, eating appropriate or good nutrition, and distressing ourselves or connecting with other people. So ito yung mga bagay na meron tayong control. Another advice or another idea that I can put into elaboration is recognize that you are performing a crucial role in a pandemic and that you are doing your best or that you are doing the best that you can with the resources available. So connected din siya dun sa naunang dalawa. So kailangan mo lang maging mabait din sa sarili mo. Kailangan mo lang na maging more accepting and maging more forgiving sa sarili mo. At kailangan mo ding i-appreciate yung sarili mo na no one likes the situation, no one can control the situation, but at this point in time, your job or your work as a frontline worker is very important and it is crucial for the health of other people. So as much as possible, if other people forget to appreciate you, ikaw dapat din manggagaling muna sa sarili mo yung appreciation that you are doing your best on an everyday basis. Kada bumabangon ka, kada pumapasok ka, napapagod tayo, nauubos yung ating energy, nauubos yung ating resources. Pero the following day, anong ginagawa natin? Bumabangon pa rin tayo. So that could be a recognition that we are doing everything the best that we can in this crucial situation. Okay. So another advice or another thing that we can do is increase our sense of control by keeping a consistent daily routine when possible. So sabi nga natin, VUCA, this is volatile, uncertain, complex, and ambiguous situation or scenario. But there are things pa rin naman that we can do in a regular basis. So for example, yung sinasabi natin na routine, as much as possible is routine or pare-parehong oras ng paggising, pare-parehong oras ng pagtulog, and then consistent na oras ng pagkain or acquiring good nutrition. And then you insert activities that sa palagay mo is nakakatulong para makapag-relax ka, such as yung sabi natin kanina, exercise, meditation, talking with family members or with friends para ma-distress, magkaroon ka ng mas magandang communications with them, makumusta mo sila. So, you can still do things na kahit sabihin natin na napaka-uncertain yung situation, meron ka pa rin pwedeng panghawakan na schedule na pwede mong maging routine. Okay? So, another point is, do things you enjoy during non-work hours. So, dito ang ibig nating sabihin is have a consistent work-life balance. So, if you are in a working hours, you focus and concentrate on the task at hand. If you are at home and you are with family, you spend the evening or the hours with your family, communicating with them and socializing with them, pangungumusta sa kanila. So you balance your work and your family time or your personal time. Kasi sa pagbabalance ito, may iwasan natin yung burnout, may iwasan natin yung fatigue. So, yun nga lang, ang harsh reality sa atin sa ngayon, yung mga hindi frontliner, kasi ang frontliner, kailangan natin pumasok on a daily basis, di ba? Pero yung mga hindi frontliner, because of the flexible working schedule, nag-work from home na rin tayo ngayon, di ba? So, yun yung isa nating concern. Paano natin mababalance yung ating time kung yung ating bahay ay nando na rin yung ating trabaho? So, yun pa rin, scheduling pa rin. Okay? So, another point is, if you feel you may be misusing alcohol or other drugs, including prescription drugs or illicit substances, maybe you assess yourself and then you ask for help. Kailangan mong magpakonsulta, kailangan mong humingi ng tulong. We know na some people would have this initial reaction na just to calm their nerves or para makalma nila yung kanilang sarili or something na ma-address nila yung kanilang problem would drink for some days or some nights. Pero pag nakikita natin na this is more than the usual, nagkakaroon na tayo ng concern or ng problem, nakikita na rin ng ibang mga tao na this is not our usual behavior at naapektuhan na tayo ng mga tinitake natin, maybe it's a high time for us to evaluate ourselves and ask for help. Okay? So I think I have 3 more. So ang isa pa nating advice is engage in mindfulness techniques such as breathing exercises and meditation. So marami naman na pong mga videos on sa YouTube or sa mga social media that teaches or that teach mindfulness techniques such as breathing exercises, meditation, grounding technique. So these are mga activities or mga stress relievers that you can learn by yourselves and then can practice it para mabawasan yung inyong mga negative thoughts, uncomfortable emotions, mabawasan yung stress. So this would give you more focus, more engaged in the things that you are doing, and then this would somehow address your anxiety and kung ano pa yung mga nararamdaman nyo na hindi naman usual ninyong na-experience dati. So another thing is, if you are being treated for mental health condition, continue with your treatment and talk with your mental health specialist or with your service provider if you are experiencing new or worsening symptoms. So that is the challenge ngayon ng ating system, ng ating health system. Because we are prioritizing COVID, yung ating mga yung ating mga service user or ating mga individuals with mental, neurological, and substance use problems or conditions are now limited to going to hospitals because of the restrictions na rin. And of course, some hospitals would defer their face-to-face consultations because of the infections or because of the COVID. So, kung kayo po ay mga service users o mga patients na mayroong mga ganitong condition, you continue your medication as much as possible. You try to set up an appointment with your mental health provider through online, or pwede din naman po na you call the available mga helpline na pwede ninyong matawagan in case that you need help. Okay? And last but not the least is keep where to go if you need, know where to go if you need help. Of course, sabi natin, in these times na medyo ambivalent or ambiguous, complex, uncertain, kailangan alam natin kung sino yung mga pwedeng makatulong sa atin. Dapat alam natin kung sino or kung saan tayo pupunta kapag kailangan natin ng mga services na ito. Okay? So, yon Ayen, ikaw, meron ka ba sa mga advice na yan na pwede mong or nagawa mo na or ginagawa mo sa ngayon?
Well, I've sought help before. So, nagpa-therapy na ako for the first time in my life. Akala ko dati it's like yung naka-couch ka, tapos makikinig lang yung psychiatrist about your problems. Pero medyo ganun din. But I think it was just reassuring to know that something that she told me was like I was reacting normally to an abnormal situation.
Situations, yes.
And we are just doing, as you mentioned kanina, we are just doing the best that we
That we
can.
can, yes. With limited resources and with the uncertainty of the conditions at present. So,
And sometimes our best now is very different from our best pre-pandemic.
Before,
and that is
yes.
okay. Because at least we're still surviving. We're still trying to help other people. And as you mentioned, kailangan magtira din tayo para sa sarili natin. If we want to spread kindness, we also need to be kind to ourselves.
Yes, because kindness begins in ourselves before we spread kindness to other people. Tama yan. Okay.
Salamat. Dami mong quotable quotes tonight. And actually, ang dami na rin comments and questions in our comment section. So we'll welcome back Ryan and Faith so we can have a more meaningful discussion na lahat tayo magkakasama na.
Okay.
Hi.
Hello! Welcome back!
Hi.
Hello!
Welcome.
Hi.
Okay, so the first Q&A, ang daming questions, but I think one that I saw was like, how can we help or support a family member who is a frontliner? So para sa amin ng mga stay at home or work from home, ano yung mga bagay na pwede namin gawin para matulungan yung mga mahal namin sa buhay na essential workers that are currently outside? And let's start first with Faith.
Okay, so siguro one of the things that family members can do is to be there as a source of emotional support, as psychosocial support for our frontliners. Be there to listen if they need to vent out. Because yun nga, they are experiencing so many things right now that they may not have a safe space, no, where they can express, no, what they're
Mm.
going through. So as family members, you can be there for them, no, just listen to what they're saying without judging or without trying to fix the problem for them. Yun. And also, siguro one other thing na cute na we can do for our frontliner family members is to give them care packages. So these care
Yes.
packages can also be, they can be either in the form of physical gifts or food, ganyan. You can send it to them while they're on duty, or they can also be something digital, no, so that they know that they are being thought of. Right.
Thanks, Faith. So minsan it's just the presence, right? Our listening,
Yes,
making sure that we're there, even though we don't really have the answer, because at this point, no one knows the answer or solutions to all of our problems.
right.
How about you, Ryan? Ano pa yung pwede namin gawin para supportahan kayo?
I think one of the most important things na, yun nga, I always tell my friends, ganyan. In the perspective kasi sa frontline, sa ER, we always see kasi the bad things that this pandemic causes. Usually sa lay people, yung nakita kasi nila yung mga mild symptoms, ganyan. Sa amin kasi sa ER, nakita namin yung pangit. And you have to understand na yung mga frontliners, nakita nila yung really, really bad side of the pandemic. So that creates anxiety, a lot of
Mm.
anxiety, because you don't want that happening to you, to your colleagues, and most especially to your family. So if you have a family member who's a frontliner, ganyan, always just try to make sure that you're healthy as well. Follow all the guidelines, the pandemic guidelines, social distancing, wear your masks, make sure na alam ng mga family members yun na frontliners na safe kayo, healthy kayo, and that you have the household under control. Ganon.
Mm.
Parang pag alam namin, alam mo yun, parang kahit di namin, like for me, for example, tagal kong di umuwi, pero confident ako na like my family, my parents have the household under control, they're keeping the infection, wala as in at bay, ganyan, walang mahaharm. So, yun, mapapanatag kami. So, we can focus on our work, hindi siya added stress.
Mm. So by taking care of ourselves, parang we're
Yes.
already helping you because you don't have to think about us na rin.
Yes.
Rodney, may gusto ka pang idagdag?
Yes, for me siguro yung how can we support our frontliners kahit hindi siguro natin sila kamag-anak, no. So we can address several levels of needs. So one is the basic needs and security. So ito yung food, shelter, transportation, PPEs, hygiene kits, ensuring their safety, they are being protected, at meron silang appropriate na information. So that's the basic needs and security. The next level for me is about community and family support. So ito yung communication with your support system, resumption of your social connection or network, structured group activities such as recreational activities or sports activities, pero syempre with physical distancing, and having a safe space or place, sabi ni Faith kanina. And then the third level for me is the focus and the non-specialized support, wherein yung mga individuals who are needing psychological first aid, basic mental health care, o kaya family visit, or needing for intervention such as talking with a hotline o kaya support group. Ito yung pangatlo. And then yung pinaka-list na kailangan pag minsan, or hindi naman pinaka-list, pero pinaka-kukonti yung nangangailangan at times is the specialized services. These are the services that can be provided by your mental health professionals such as psychotherapy, psychiatric medications, management of severe mental health problems or concerns. So for me, I think yun yung sagot ko, yung address the different levels of needs ng ating mga frontline workers.
Hmm. And minsan kailangan mo lang din sila tanungin, di ba? Kung anong kailangan nila. Since iba-iba naman tayo ng pinagdadaanan kahit na lahat nasa frontline. So whatever works for your loved one might be the best kind of service or help that you can provide. All right, so we have another question from Janine Del Mundo. Question to for Miss Faith, but if anyone else wants to answer, you are free to do so as well. So do you think po that there are realizations about mental health that emerged during the pandemic or now that we're still currently in a pandemic? Nag-iba ba yung understanding natin of mental health as Filipinos?
Mhm. Okay, so actually, what I always tell people nga is that one of the good things that came out of this situation is that we are now more open to talking about mental health. There's greater awareness, especially now that we're all stuck communicating with each other on social media because we can't really go out to meet with our friends. No? So everything that we're going through, we try to communicate with other people through social media. So there are a lot of people who can see them. We have a bigger audience now when we talk about mental health. So there's greater awareness also. So basically, we normalize talking about mental health. So given this change in openness in talking about it, we now give higher priority to our mental health. Of course, we have to prioritize our physical health, physical safety, security, but tumaas na ngayon yung pagbibigay ng value sa ating mental health and psychological health. So, it's a good thing because people now start to give greater regard for self-care.
And I mean, it didn't have to take a pandemic for it to happen. But kung meron mang silver lining, at least
Yes.
mas marami ng pinag-uusapan na ganito. How about you, Rodney, as a
Right.
psychiatrist? Meron ka pa bang thoughts on
Thoughts
how,
about
or
this?
understanding,
Oo.
of mental
Yeah.
health?
More than dun sa COVID, kasi sabi natin we are experiencing the effect of COVID, yung isolation, yung fear of contagion or being infected, and then the disease itself, di ba? So ito yung nakikita naming mga mental health specialists or mental health professionals na first wave. Pero the second wave is that after this event, yung impact sa ating mental health, sino yung mga nagkaroon ng anxiety, sino yung mga nagkaroon ng depression, sino yung nagkaroon ng stress-related reaction, sino yung mga nagkaroon ng exacerbations of symptoms kasi hindi sila makapunta dun sa kanilang mga mental health services or hindi nila ma-tap yung kanilang mga mental health professionals. So nakikita namin na more than COVID or after the COVID or even during the COVID, mas baka tumaas pa yung need natin na mas maging aware on those people na kailangan nating tulungan na may mental health concerns. Kasi nga, sabi natin, this is the impact of COVID na hindi natin nakikita pa sa ngayon.
Na kapag tapos na yung COVID, meron na naman tayong bagong pagsubok. But hopefully, we'll feel more prepared because we're having these conversations that we're having just like tonight. Thank you guys. For the next question, it's from Joshua Soredo. Where can people get treatment for anxiety, panic, or disorder, depression? So kahit anumang mental health crisis, ano yung steps that we can take to seek help? And maybe Ryan, you can share your thoughts first.
Well, yung ER naman kasi it's we're supposed to be equipped for all kinds of emergencies, and what not many people understand is that yes, your mental health, stress, yung mga depression, ganyan, they are part of emergencies. So if you feel really down, if you feel like pero tas kung may wala kayong kasama or like merong sasama sa inyo, actually anything, if you feel the need to go to an ER. Pero I think kasi syempre not all of the people na manonood nito would have that kind of support or bravery to actually go to the emergency room. At saka syempre yung iba may anxiety pa yan, may takot pa yan kasi nga may COVID.
May
diba?
COVID kasi.
So baka naman ma-infect pa sila, ganun. So actually, I think ako yung point ko before I toss this to Doc Rodney, because I think he would be able to answer this question better, is ako at least, if you feel like you have to go to the ER, go to the ER. And right now, at least what the lockdowns were able to do for us is that it gave a lot of time for hospitals to adapt to a new normal setting in such a way na yes, we still have COVID. Yes, we still have COVID areas. But now we actually have areas for patients na non-COVID din. So you don't have to be scared anymore na baka pag nag-ER ka, magkaka-COVID ka. Because yes, yung hospitals naman right now are able to now adapt better dun sa pag-segregate ng COVID versus non-COVID. Pero for like specific, like kunwari, like ayaw mo pa naman mag-ER, I think Doc Rodney would have more suggestions for this.
Okay,
Salamat, Ryan.
Thank you, Ryan. No? So, ikaw na nagturo. So, sige,
Oo.
tama naman si Ryan doon. I appreciate,
Moderator na si Ryan.
I appreciate, Ryan, that the ER is equipped. Kahit na yung
Yeah.
regular ER natin or our general hospital ERs are equipped in assessing individuals who might be experiencing anxiety, panic, or depression. So, you have different options. So, we have institutions that are private that have psychiatrists or mental health services. We have also government hospitals with mental health services. So for now, sabi nga ni Ryan, because of the limitations in the movement and restrictions in travel and because of the focus on COVID, so the face-to-face consultation is now temporarily halted or suspended. So, but what is we realize ngayon, mga mental health professionals at mga doctors din, is that we can do naman pala online consultation. So there are various platforms wherein you can ask or you can tap for help. So si Faith will have their society, the Philippine Association of Psychologists, ay meron silang sariling website to connect or to link people who are needing advice or counseling or kung gusto may makausap pag nakakaramdam sila ng ganito. Our National Center for Mental Health has this NCMH Crisis Hotline Facebook page wherein they can visit and see kung paano yung procedure or protocol on asking for help. And then our organization, our professional organization, the Philippine Psychiatric Association, is also having online services para dun sa mga nangangailangan. And aside from this, marami pang iba na mga mental health advocates na meron din silang mga services na pinoprovide sa iba't ibang needs ng mga individuals na nakakaranas nito. So, hashtag mental health PH, Youth for Mental Health, what else? In Touch, and marami pang iba. So, yeah, maybe you can visit the NCMH Crisis Hotline web page or Facebook page kasi nandun po yung mga listahan ng mga service provider na pwede nyong itap depende kung saan kayo mas komportable o saan kayo malapit. Yun.
Salamat, Rodney. And yun nga, ang daming free services that you can avail now because a lot of our frontliners are actually offering their services for free, whether it's yung telepathy or just also reading stories and advices from all these different communities. The next question, which is our last question, is also related to that. So from Barbara Isis, how do we know if our co-frontliner or worker is having a mental breakdown or physical depression, exhaustion without them telling us? So what are the early signs so that we can prevent suicidal ideation and them hurting themselves? And maybe we can start first with Faith.
Okay, so actually, burnout, stress, exhaustion can manifest behaviorally. So you can actually observe your coworker, your co-frontliner, if there's if there's change in terms of how they behave at work. So for example, absenteeism, no, laging nag-absent, or laging late, tardiness, late or incomplete delivery of work or work outputs. No? So, are getting holed up in your room, nag-isolate, pati yung mga things that we do like binge watching Netflix shows no, instead of doing work. So, also avoiding work. So, all of these things could point to something being terribly wrong no, with how they are on the inside. So, it manifests on the outside behaviorally. Yun. Ryan, want to say something?
I feel attacked. I feel attacked. Netflix, binge watching, hardiness. I feel attacked.
Kaya ka pala tumatawa.
Yes. Mm-hmm.
I feel attacked. No, but sobrang tama. And ako personally, I was losing weight.
Mm-hmm.
I was losing weight. Na I had walang diet, nothing. Tas ang lakas ko kumain, but I lost 5 kilos in 2 weeks. Ganun siya. So, yeah. So, behavioral, physical, science, mga ganun din. So, mapapansin nyo din sila. At for me, tama yun.
And now that you mentioned that may signs, what can we do once we know those signs, Rodney?
Yon. So, dagdagan ko lang yung sinabi ni Faith, no? Kasi kung burnout, makikita naman natin siya kaagad. Ang acronym na ginawa ko is I, C at E. So, I is inefficiency in work. C is cynicism in work. So, meron ka ng negative na view dun sa ginagawa mo. Hindi mo na siya na-enjoy. Nagre-reklamo ka na, which is not usual naman sa'yo dati. Lumalayo na yung loob mo sa trabaho. And then, E is exhaustion or parang ayaw mo nang bumangon, ayaw mo nang pumasok. So, ICE. So, ito yung sinasabi natin na burnout. Kasi burnout, pagdating sa WHO, is specifically related to work. So, napaka-specific niya. These are not conditions, but these are not medical conditions, but there are predisposing factors for an individual to have more complex or more severe mental health problem. So, bukod doon, ano pa yung mga palatandaan kung hindi sila nagsasabi? So kaming mga mental health professional, we are very keen on asking changes in functionality. And when we say functionality, we view it in 3 aspects. One is intrapersonal or self-care. May pagbabago ba from the baseline kung paano mo inaalagaan yung sarili mo? Nakikita nila, hindi ka na naliligo, ang baho-baho mo na, hindi ka na nagsusukla, hindi ka na nagsishave, di ba? O kaya hindi ka na nakakatulog ng maayos. So that's self-care. Then the next one is interpersonal. How you relate with other people. Nagbago ba yung behavior mo? Naging masungit ka ba? Naging aloof ka ba? Isolated ka ba? Mas hindi ka na ba nakakausap ngayon? Nagiging magagalitin ka ba for no particular reason at all? Which is not your usual behavior as compared to before. And then the last one is academic-wise or occupational-wise. So ganun pa rin, the efficiency and efficiency, yung sinasabi ni Faith kanina, it could be absenteeism, hindi na talaga pumapasok, which is severe. It could be presenteeism. Pumapasok ka pero wala ka na-accomplish, di ba? So, poor ang concentration mo, paulit-ulit yung ginagawa mo, nako-call out yung attention mo ng iyong mga supervisor o kaya teacher mo. So, if there are some changes in the functionality, pwede nating sabihin that could be something na baka kailangan na nating i-evaluate kasi it might be leading to a dysfunction or to a disorder. So, yung yung tanong mo kanina? Ang tanong mo kanina ay
pag alam mo na yung signs, ano na yung next na action plan? Ano nang pwede
pag alam mo na yung signs, so sabi natin kanina, self-awareness, kasi kailangan alam mo kung paano ka nagre-react sa stressful situation. Kasi kung hindi mo alam kung paano yung nararamdaman mo, some people can naman observe it or mapapansin naman nila. Kasi some people would use coping mechanisms na hindi appropriate, such as denial. So tatanggi nila na sila ay may problem, pero nakikita ng ibang tao na merong pagbabago dun sa behavior at needing attention. So number 1 is awareness. Kailangan maging aware ka na merong nangyayari sa'yo at kailangan mo ng tulong. So yun yung number 1. Kasi kung ikaw mismo ay aware at meron kang acceptance doon sa iyong sitwasyon, mas magiging madali yung mga susunod na actions kaysa yung pipilitin ka ng ibang tao. Pero may mga times hindi din applicable yon kasi sabi nga natin yung coping styles ng ibang tao hindi appropriate for the situation. So if family members or if loved ones or mga friends naman na nakakapansin nito, maybe balik tayo dun sa basic na sinabi natin, let's talk, pag-usapan natin, kumustahin natin. Kasi baka mamaya, doon sa pagsisimula or pag-initiate ng talk, maybe over the cup of coffee, makakapagkwento siya, mas marirealize niya na meron na palang something wrong sa kanya. So, yun ang aking sagot.
And mas powerful pag yung mismong tao yung makarealize na, okay, this is not normal, I need to seek help, para meron din silang ownership with that problem. But even a simple cup of coffee and how are you, kamusta ka naman, let's catch up, could make a huge difference in someone's well-being and health as well. Alright, so actually sobrang dami pang pwedeng pag-usapan. Pwedeng hanggang dito tayo ng midnight. Pero mahirap naman yun for our own well-being and health. So I guess I just wanted to know if they have other questions and they wanted to know more about your work or ask for advice, what are some ways that our listeners can reach out to you? And we can start first with Rodney. Paano ka namin mas makakausap pa even after this webinar?
So for those individuals who are needing yung mga nalulungkot, gusto na makausap in distress and who are experiencing something and need to talk to someone, you can always check the NCMH Crisis Hotline Facebook page. And of course, we have crisis hotline numbers, toll-free number 1553. And then we have also globe number and landline globe number. So check the NCMH website or webpage. And then for those naman na gustong may itatanong or whatsoever, may gustong i-consult or discuss with me, you can reach me through my Facebook, Rodney Boncajes, or the same with my messenger, or you can follow me at my Instagram, Rodney_Iron and or to my Twitter, or follow me on Twitter at Finding Rodney.
Daming platforms. So finding Rodney at Twitter and also on the Facebook page. How about you, Faith? How do we reach out to you?
Siguro before I tell you how they can reach out to me, I just want to emphasize na self-care is not a luxury. So, yun, we have to prioritize it, be kind to yourself, and also make sure that you have a space where you can pause. Yan, siguro yung very first thing that you can do after the awareness is to pause and breathe and find a safe space within yourself. Yan. So having said that, I don't know if they can contact me directly, but they can avail of our services because I'm part of this group called Art Psych Circle. So we actually have an ongoing program now, especially for frontliners. So this is expressive arts-based creative retreats for frontliners. So this is ongoing until December. Please go to our Facebook page, that is facebook.com/artpsych circle. And then you can see there the announcements that we post about this program. So you can actually register and join our wellness workshops. Yun. So art can also help in self-expression and also part of self-care. That's
Great.
one. And then, yes. And then another would be, I'm also part of this group called Lunas Collective. So if the concern now is about gender-based violence, domestic abuse, now I hope no one is experiencing that. But if you know anyone, if in any case you are undergoing that kind of challenge right now, you can go to facebook.com/Lunas Collective, and we have a chat-based psychosocial support service. If you also have needs in terms of reproductive health services, we can also aid when it comes to that. We have counselors and legal assistants to give you or to assist you with those kinds of concerns. And then
All right.
finally, I actually,
Meron pa
yeah,
kayo?
yeah. ito na yun.
Yan
And then
na.
finally, I
Yan
have,
na.
I have a YouTube channel. Yeah. So my YouTube channel is, you can go to bit.ly/Miss Faith YT. That is MISSFAITH all caps. So you can go there and you can check out my videos. They're all about mental health, psychology, and I also have my cover videos there with me sharing about my reflections and thoughts and giving advice also and psychological advice. So you can go to those social media accounts to reach out to me as well.
All right.
Okay.
Thank
That's it.
you.
Mhm.
So
Subscribe,
any
follow, and share.
follow, like, share,
Yes, like and
subscribe.
subscribe. Yes.
Like
And
and
last but
subscribe.
not last but not the least, Ryan, how do we reach out to you?
Actually, nag-join na ako dun sa Facebook, dun sa art site for frontliners
Nice.
ni Ma'am Pete. For
Wow.
me,
I'll see you there.
yeah, yeah. For me, well, in this pandemic, it made us made us realize more na we need people on the ground, people here. So if you want to become an emergency medicine physician, a specialist, promise kayo yung magiging pinaka-equipped when it comes to future pandemics. You can join us at Hospital ng Makati. You can go to our Facebook page. It's facebook.com/emergencyosmac. We are now accepting applicants for all doctors. And then dun sa mga magpo-boards pa lang, we are also accepting applicants na even if you haven't boarded yet. If they have questions for me, yes, particularly regarding emergency medicine, and things that I can answer, they can go to my Facebook. My messenger is Ryan Magtibay MD, and that's also my Twitter na at Ryan Magtibay MD. So they can ask me there. Yan lang.
Alright. Actually, marami nagtatanong how to share or link or reach out. I think Coffee Bean will also just post it, and this video will be available on replay. So you can always check it out, replay, and find a way to follow all of our guests for today. So the last part na lang of our kwentuhan is the best part for most people, the giveaway. So let's first read some of the
Yay!
messages that you guys have sent for our frontliners. And since meron tayong frontliners na kasama ngayon, these messages will also be for you guys. Okay. Okay, so the first message is from Kristine Joy Tonogbanwa. Dear frontliners, keep strong, always pray. Thank you on behalf of the patients for your good deeds, even though you really want to give up, but you still continue to do your job. God bless po everyone, and we promise to follow the protocols to lessen your job. Ryan, nakinig siya sa'yo.
Yes. Thank you.
And I
thank
know
you.
that thank you is not enough. Thank you is not enough, but it's still a really good start. All right. The next one is from Regine Chris Samson. To all the frontliners out there, may God continue to protect, guide, and strengthen you. And I will continue to pray for all of you as an exchange of your services. Thank you, and God bless to you and your families. Thanks, Regine.
Jane.
And then next is for Mercy Galolo Turado. Thank you to all the frontliners. We're so proud of all of you, and we're praying for your protection, and may the good Lord bless and give you all more power and strength so that you can continue to serve our fellows. Again and again, thank you so much. God bless us all.
Thank you, Mercy.
Thank you.
And then the next is Cesar Baraga Salmat. Sa lahat ng mga frontliners natin sa buong mundo, mabuhay kayong lahat. Huwag kayong magsasawang maglingkod sa ating bayan. God bless you all. Salamat, Cesar. And the next one is from SHN_CLLD. Thank you for your dedicated spirit in pursuing care for others. You continuously inspire us to pursue our work in promoting sustainability, health, and wellness for society. Thank you.
Thank you.
And you can continue doing this even if hindi na dito sa webinar. It's always nice to reach out, especially to the people that we know. And the next one is from Arthur. May God bless everyone, to all those who work for the safety of everyone. Next is Trizia. Ang dami. I love it. Thank you for your sacrifices. May God bless and keep you and your family safe and healthy. Thank you. And alam ko marami pang messages. So for everyone that did that, thank you guys so much. I hope that feeling of also spreading kindness to others also makes you feel good and know that we're all in this together, regardless of our role. And so now we will pick a winner. So drum roll, please. Samahan niyo naman ako sa drum roll.
Drum roll, drum roll, drum roll, drum roll, drum roll.
Since parehas pa kayo ng damit, diba? Okay, so our winner is...
Congrats!
Drum roll! Ayun na pala, nandun na. SHNCLLD.
Congrats!
Congratulations! Please send a direct message to the Facebook page. And to everyone who sent in their greetings, thank you all for the heartfelt messages. And thank you to our guests as well. So thank you, Ryan. Thank you, Rodney. Thank you, Faith, for joining us on our first ever, very special, memorable Caring Cup Conversations.
Thank you.
And again, maraming salamat sa lahat na nakikinig. We hope that by just listening to our medical experts and our frontliners, mas naintindihan nyo how to cope with the problems that we're facing. As mentioned by Rodney, we're in the same ocean, pero magkakaiba tayo ng boat, and we're just doing the best that we can. So be kind to yourself. There is no shame in seeking help, and continue to have conversations with our loved ones so that we all feel more that it's not just us alone going through the struggles and problems. Actually, the problems will become easier to bear when we do it together. So thank you, guys. And this is just
Thank you for having us.
Thank you also. Stay tuned for announcements on our social media platforms for the upcoming episodes. It will be Coffee Bean and Tea Leaf and Caring Cup on Facebook, and at CBTLPH and at Caring Cup on Instagram. Again, I'm Ayen de la Torre. Thank you guys for joining Caring Cup Conversations, and I hope you all have a good night. Cheers! Thank you
Yes.
guys!
Thank
Maraming
you.
salamat.
Thank you.
Thank you, Iris.